But that's 1/4 of the 200 million that was given to the state. And I guess the question becomes, were we just given too much money, or is it that there are not enough people in Rhode Island?
You never can get enough money. So as I've been asking our congressional delegation, we want more than our fair share. In this instance, and we're going to keep all that money, that's the plan, and we want to get it out to everybody that needs it. But yeah, on a per capita basis, we've received significantly more than other states, right? Because we had the minimum amount. I think if we were to get on a per capita basis, we would have got more like $76 million based on the calculation. We got $200 million on this first. So yeah, so I think that a slow start with some complications has taken a little time to get some traction. I believe that we do have traction. I think it's a big news story that we have taken the lump sum payment off on the utility bills in that tune of that $16 million. That's something that we have been working with the White House and clarifying that we believe that the way we've done it is done appropriately. So yes, but we got more to do, and that's why I was mentioning earlier that I met with the community action programs, the partnerships to get them engaged, and we encourage everybody who feels as though they have a constituent base that they feel needs help on rental assistance or utilities, they should be contacting our office, because we're going to continue to be very aggressive in getting those funds out.
Sounds like, well, two questions. It sounds like you've been very aggressive. That was the news out of one of your prior press conferences, and yet you've only been able to spend the $51 million. So either there just is not the need, or, assuming there is the need, people don't qualify.
Yeah, so and we're getting reports back. We had our office at some of these sessions this weekend where people have come in. There's still a demand. I feel as this one I was reported with the Rhode Island Housing on our weekly call with our executive team that there was 100 people or more at this signing up for the application. So we know the demand is still there. We still feel as though we can do better, and we are going to do better. But I can tell you that and we're tracking what other states are doing on a percentage basis of what they would have received on population. Right now, we're doing well, but my opinion is we can do better. And so with the more partners that we bring into the mix, I believe that we're going out for an RFP in about 3 weeks for a distribution of those dollars, so that we engage more than just the Rhode Island Housing in the effort.
Finally, one as quick as you can answer
yes.
it, but I'll ask it quickly. With respect to some change, what was the change that enabled you to give out more utility dollars? What specifically?
I think it was
happened?
we worked with in our calls with Treasury and the White House from our office, and I was on one of those calls, and we helped simplify the application in a real dramatic way. And we also determine how we could do a batch against the utility backlog in terms of the how much people were owed there, and we worked that way through. So I think that a lot had to do with our office stepping in and clarifying ways that we can do it better. The message that I'm still getting with people who are in our office at these sign-ups with the for rental assistance is that the application is still too cumbersome, and we're going to continue to work to simplify that.
Governor, you mentioned ILO in your opening remarks about getting schools ready. What do you think of the oversight committee hearings that are taking place this week on that contract?
Yeah, you're going to hear me talk more and more about ILO. I think that today we'll have the opportunity, and I think that is spelled out in the things that we have already given to everybody. There's no information that we're not providing, including meetings that we had prior to the bid going out with Mike McKee and with purchasing and with Jim Thorson. This is what I think about it. Let's think about where we were in March. I want everybody to kind of move back to where we were in March. The uncertainty, and it was written, basically, will Governor McKee be up to the task of entering into one of the worst crises in the history of the state of Rhode Island? I was very clear at that point in time. It was shots in the arms, it was reopening the economy, and it was reopening our schools. So we're going to show that we followed the procedures that were in place. We got really good, skilled people where we needed them, and they're doing important work. So that's what I would expect is going to come out. You know, will that come out in some of the reporting that's going on? That's, you know, that's left to be seen. But the fact of the matter is that the process was followed. We got really good people in the skill sets we needed on education, both on higher ed and the K through 12. And not only are we leading the country in terms of vaccinations, leading the country in less infection rates, and that's something for everybody to be aware of and be proud of, but we also leading the country in terms of opening our economy. And right now we are leaders in the way that we've safely reopened our schools. Our partnership with Department of Health, Rhode Island Department of Health, Rhode Island RIDE, as well as our office, and I do know a little about education. We're sitting in Providence right now with a teacher contract that is settled and not disruptive. That clearly has something to do with the work I've done. So people can kind of question whether we're doing it right, but just look at my history in terms of what I've done in education. We know what we're going to be doing is important, and we know we followed the process that was outlined. By the way, it's, you know, we know that the General Assembly sets the process that you need to follow. So that was followed. We got really good people in place, and we're doing important work.
On schools, different note, with the Pfizer vaccine potentially being approved for 5 to 11-year-olds on an emergency use basis coming up, and one would assume down the road full authorization, do you think that the COVID vaccine should be mandatory in schools in Rhode Island?
No, right now I think that we're working through the healthcare, vaccine protocol we put in place. I think we need to kind of work through that, make sure that we have it settled. Our infection rates, again, are lowest in the country right now across the board. We've got 90% of the teachers vaccinated and the supportive staff vaccinated through just a process of like making it available to them. We'll do the same thing with the students. Right now we are in a metric. I think we're approaching 55 or 60% of the students vaccinated in the state of Rhode Island. We'll get to a high number. We'll be another leader in that area. And on the 5 to 11, yes, we are planning right now to make that available, just like we have made available all of the vaccinations. We also have mentioned about test and stay. We'll be in Westerly this week talking to the superintendent there. Smithfield asked me yesterday. We'll be also working with test and stay strategies and overall to keep the kids safe. So it's a combination of things, including vaccinating the 5 to 11.
If I could just follow up,
yep.
One more. You mandated the vaccine on healthcare workers, noting that they have to get vaccinated for other things. Kids have to get vaccinated for other things. You seem to be, as you've mentioned for months now, reluctant to mandate the vaccine, but you're for mandating other entities mandating the vaccine. It seems when vaccines are mandated, the numbers go up. If that's the ultimate goal, why again?
Well, let's look where we are right now in terms of what we've done, right? We have 80% of our adult population fully vaccinated. That's like 4th in the country. I think we'll be at 3rd in the country very shortly. We have approaching 90% of the adult population with 1 shot in the arm. So I think that the methods that we've used, and quite frankly, we were last in vaccinations when I showed up. And bringing municipalities in, doing the strategies that we have, we're leading the country in vaccinations. So, and that's allowed us to be safe. So we'll continue to work as best we can without any level of mandates, because I don't think that those really work unless there's a real need. I felt in the healthcare area that I think that we needed to support the hospitals and the nursing homes who have asked me to support that, and I thought that that was an important piece to do. We will continue to keep the kids safe in the schools, worked on test and stay, that's the next project, and then, as you said, thank you for saying it, when the vaccine becomes available to 5 and 11, we will be as prepared as we were when we built out the capacity, put shots in the arm. At one point, we were able to do 100,000 shots in any given week. So I got my 3rd shot the other day. We're going to keep on working to get people vaccinated. That's our key to open our economy and reopen our schools safely.
Thank you. Alexa? Hi, Governor. Lifespan and CNEs resubmitted their merger application yesterday, their HCA application to the Attorney General's office. It hasn't been deemed complete, and it won't until November 16th. But in the meantime, what are you asking from executives to demonstrate for this merger to occur?
So I think, again, I want to be very clear on this, is that the merger is there's been a resubmission to the FTC. We are aware of that. we're looking at the Department of Health and the Attorney General's office and all the regulators to ensure a couple things to happen. One, to maximize all health issues in the state, and then all economic opportunities, and make sure we're protecting the patients. So we'll leave it up to the regulators right now to engage in the way that they are obligated to do, and we're going to encourage them to make sure that health is a priority, the patient's health is a priority, the economies, and making sure that we're set in a way that long-term we can satisfy the health care needs in the state of Rhode Island.
Of course, sorry, just one follow-up. Of course, Governor Raimondo had tried to push for this merger, having an in-state solution instead of, someone like Partners coming in and merging with Care New England. So is that what you're hoping for as well, some in-state solution that could possibly increase access but could raise costs? What are you asking?
No, what I'm asking is that the regulators, which is the Department of Health, as well as the Attorney General, take all those things into consideration. I happen to believe that whatever is benefiting Rhode Island, we want. We want our docs to stay here. We want our universities to be engaged. We don't want to be, sending those things out of the state when we can, if we can come to an agreement, whether it's in this merger or some other transactions that need to happen in the healthcare industry in Rhode Island. I think those priorities is making sure that it makes sense to the patients. It's economically strong for the state. I think those are considerations that I'm saying publicly here, and I've said publicly to both parties that are going to be doing the regulation on this, the regulation oversight on the application.
So to be clear, you don't think that this merger could be the only solution?
Whatever is the best solution for the state of Rhode Island, that's what I would be asking them to take a look at. And they should be open-minded about that.
To return to the rent relief and more generally housing issue, it turns out that rent relief is the lead news story in the Motif magazine that comes out tomorrow, so I'm fairly immersed in this right now. The Rhode Island Housing told me last Friday, that Rhode Island has been allocated a first tranche of about $200 million and a second tranche of about $152 million for a total of $352 million. And as you noted, that Rhode Island is getting a certain minimum boost because of its small population, and otherwise we be getting about 76 million. But you mentioned that you are talking with the congressional delegation, and you want to use all that money. And given that the federal government and Congress have set forth certain restrictions and requirements for the program, it's very doubtful that we would have enough people who qualify for using $352 million. So are your conversations with the congressional delegation trying to increase the flexibility of that in order to use that money, or where do you stand on that?
So our conversations are with our congressional delegation, but the people who are going to set the guidelines are going to be Treasury and the White House. So we're having direct calls from our office there. I think there's still room to simplify the application. We know that there was, I think, a couple hundred people that were looking to fill out an application at a kind of a rental housing, clinic, I guess you would call it. So we know the demand is still there. Our job is to retain the money and get it out to the people in the state of Rhode Island. That's our goal. The 76 million would have been on the first 200 million, not on the next 135 million. But yeah, I think that we need to merely make sure that everybody who's able to identify people who could use these dollars for utility, water, by the way, too. Water is a utility that's allowable, and the rental get involved. So we're going to continue to do that. That's why I met with the CAPS programs today to talk to them specifically about getting the money out the door.
So that money was made available from the American Rescue Plan Act in March 2021. And I think there was $21.6 billion allocated for rent relief, but there are other elements to that that relate directly to housing. I think $10 billion was allocated for homeowners who are behind on their mortgages. Yes. There's about $5 billion for home choice, which is essentially Section 8 vouchers, another $5 billion for homelessness. Where does Rhode Island in particular stand on those ancillary programs that are not directly rent relief?
So I mentioned about the $50 million for mortgage relief that was supposed to come out, I think in September or late August. It hasn't come out yet, as far as I understand. So we'll see what the guidelines are for that, and we'll be very proactive. our goal is to, whatever we're allocated, to make sure we get more than our fair share when we can, and then to get those dollars out. So that's the same strategy that we used in terms of the unemployment, keeping people connected to the $300 a week benefit. And we passed legislation to allow them to get back into the workforce, as you recall, and that worked well. So we're going to make sure we take advantage of every dollar that comes from the federal government. We've sent those dollars to Washington when we pay taxes. When they send them back, we want to take full advantage of them. So we're going to do everything we can to make sure that we allocate those funds in a way that helps the people in the state of Rhode Island.
Governor, yesterday you had told another outlet you won't turn your back on unvaccinated healthcare workers who might have lost their job and they have families or, of course, expenses or even lost their health insurance. We're past that October 1st deadline. What are you planning to do to help these families?
So the area that I have the ability, the people that work with me, right, at Eleanor Slater or the Veterans Home, we're still working to get up to the 100% goal that was set by the Department of Health, and I still support that. For individuals who are not, have decided not to get vaccinated, we'll still politely ask them to get vaccinated, but we are looking at ways to keep them employed in the state, and if we can actually have some lateral move by during the time frame that we get past the Delta, which was the reason, right, for the executive, the executive order was the Delta, and at some point in time we're going to be past that, and all the signs that are right now that I'm seeing, right, we have under 100 people in the hospital today. We never maxed out at the number that the modeling showed that we might get up to 800, 900 people in the hospital. We got the field hospital prepared and ready to go, and we didn't open it up because thankfully, Rhode Island is that state that is doing better than most. And again, no one's done better than the state of Rhode Island. So I would just say that in the areas that people who are in the areas that we don't manage, we're going to have our DLT available to them in terms of finding ways to get them employment if, in fact, they want it. And we'll make that very public about how individuals that may not be, again, selected not to get vaccinated. They're our neighbors, as I said. We're not going to turn our back on the neighbors, but we also are going to make sure that we set policy that keeps the overwhelming majority of the people safe in the state of Rhode Island. We know health care is an area where there's been a great deal of risk, and we're going to do everything we can to minimize that risk. But the individuals there, I've talked to DLT yesterday, Matt Weldon, to start being prepared for a strategy that could kind of have temporary placement. We have plenty of people looking for workers in the state of Rhode Island, and we should be able to figure out a way to take those people who are unvaccinated and keep them employed, let them make sure they can pay their bills, and keep their families safe.
Governor, you mentioned the eviction clinic this past weekend, also an RFP that may go out for expanding beyond Rhode Island housing. At that eviction clinic, evidently hundreds of people were turned away. RI Housing only provided 3 people to help fill out these applications that take about 30 minutes to fill out. Is the issue just human beings on the ground being able to help people? Is that what the RFP would seek, to find somebody who can satisfy that criteria?
I think it is people. One of the small business owners that had helped us in the coalition texted me about exactly that. That she was there to help out with the applications, and it took her. She was able to handle 4 applications during the time she was there. So that's why I was saying another question that the process is too cumbersome, and if and the demand is still there that I think that we need to respond to. And we still have time to respond to that. So, yeah, it's bodies, it's people understanding how to move the current applications, and it's also our responsibility in the governor's office to simplify that application process. And the only people who can do that is the Treasury and with the White House's support.
What letter grade would you give RI Housing right now? There's a lot of people who look at the organization and say, well, they've got a downtown office, high-level graphics, big social media game, expensive things, yet they can only provide 3 people for an eviction clinic.
Yeah, so I'm not into grades, so I'm not going to go for that one. But I can tell you that as I said, I started off my comments, I've been frustrated. I've sent letters to the board letting them know that this needs to be done better. We're going to continue to do that. I think that the response that has been that has happened at the Rhode Island Housing has been significantly improved, and I think that we should acknowledge that, and I do acknowledge that. But as it was presented in other questions, there's still money to be put out and to be provided to people, and we need to do everything we can. And if we need to get more boots on the ground, then that's what we're gonna encourage them to do. And then, as I said, I met with the CAPS programs today. They feel as though that they can play a significant role, and we're going to go out and seek that out. And at the end of the meeting, I said, well, I'll have Rhode Island Housing in to meet with the CAPS, and I'm going to be there watching in terms of, evaluating how much inclusiveness we have in terms of making sure we're engaging everybody that can help in the state of Rhode Island.
We have time for one more question. Yes. Governor McKee, the vaccine mandate applies to...
Pat, I'll get to you before I'm done.
The vaccine mandate applies to EMTs at fire departments as well. So I just wanted to know, there are still some unvaccinated fire department EMT workers still on the job as of yesterday in Providence. There were maybe a dozen or so. I was wondering, the Department of Health says they're going to work with them on a case-by-case basis. Is that still the case? And, when really is the deadline for people to get vaccinated? Because it went into effect 5 days ago.
So thankfully, the firefighter leadership has really done a fantastic job on the local level to get people vaccinated, right? So we need to acknowledge that. Last I heard, about 97%, so it's probably over 97% right now. And it's back to the question about what are we going to do with people who are not going to get vaccinated, that are in spaces that we believe they should be as healthy as they can to provide healthy health care. So, but I can tell you that I'm in conversations with individuals as well. I was in a conversation with somebody that was a firefighter that was the last person on their department to get vaccinated, and I got the word based on some of that interaction that that individual got vaccinated on Saturday. So we know that people are going to still get vaccinated, but what are we going to do to make sure that livelihoods are protected? That's kind of a local decision, but again, we'll work with the local municipalities. I've encouraged them to take the Department of Health in terms of the 30-day type of strategy to get into 100% compliance. And I think that most have. I was really pleased to see that 92 organizations in the state of Rhode Island are still working to get 100% compliance and working with the individuals that at this point in time have chose not to get vaccinated. So I think it's not a case by case. I talked to a dentist that was in the news this weekend, and he's going to have a hearing, and we're going to take everybody's call and respect everybody's position. And I also would have people that are in that circumstances respect our position as well, is that, again, healthcare workers need to be healthy in order to provide healthy health care. And we've taken that position, and I support it. But I also know that people who live in the state of Rhode Island who have chose not to get vaccinated, that as was said earlier, you can't turn your backs on your neighbors, and we need to kind of walk our way through as best we can to keep them whole until this Delta goes out to the Atlantic Ocean somewhere. So, and that's happening very shortly, I shouldn't say very shortly, but it's happening in, we're not going to be living this with the Delta for 10 years, put it that way. This is going to get under control, and it is under control as our hospitalization rates go down. Our death rates are leading the country in the lowest. Again, I repeat these over and over again because I don't think this is repeated enough to people. And our vaccination rates are up to levels that are, states would be very, very happy to have our vaccination rate right now.
Governor, to amplify the question about Rhode Island housing, and then a quick follow-up on another point. We're looking at a system that disseminates money and resources through a principal group of organizations. I'm talking about CAPS organizations and Rhode Island Housing. To amplify the earlier point, the director of Blackstone Valley CAPS makes in excess of $170,000 a year. The director of Rhode Island Housing is somewhere in the $200,000 range. And yet, there's no comprehensive plan for community funding of these community-driven, community organization-based clinics where people are brought in. There's no comprehensive plan for training individuals at these community clinics to be put in. Is this just a case of the political elite continuing to profit off of other people's misery?
So I'm not looking at what anybody's making. I'm looking at what they can bring to the table to get the money out the door. So that's my focus right now, and everything that we're doing, whether it has to do with vaccinations, getting the economy going, getting kids back to school safely. This is the highest priority that we have. And who can get the money out in this rental relief and utility relief? That's who I want to partner with. That's who we continue to talk to.
And then a follow-up question on the unemployment issue. Statistics and unemployment can lie, not the people delivering them, but they each provide a unique perspective. We'll put that. Is there an accounting for, in light of yet an additional wave of restaurant closings and individual outlets of restaurant chain closing this past weekend, how many Rhode Islanders were employed before the pandemic versus how many are actually physically employed right now?
Yeah, I think the number was about 78% a few weeks back. I'm sure it's higher now. I got a lesson on that exact question from Matt Weldon yesterday because I asked the same questions. Basically, how do you determine unemployment rates? I guess it's through some sort of a polling process that's done because I was getting numbers where we had just had 45,000 people come off our unemployment. We got 9,200 people on unemployment right now. And of the 45,000, 29,000 of those were gig employees. So I think that we're going to know the data, and we're going to make sure that Rhode Island, we're leading the country in many metrics. We will lead the country in unemployment as well because we know who they are and we know who needs jobs, and we're heavily working on matching up people with employment, whether they're unvaccinated healthcare people or whether they're people of gig employees that have just come off unemployment. For our economy to work, we need to have people employed at good paying jobs, and that'll be something I'll talk about at another date in terms of like where we are in Medicare right now and why we need Medicaid and how we need to get people off with good jobs out of Medicaid, because that's part of the process too in the economy. So yes, Matt Weldon is doing I'll give him a shout out. He's doing an unbelievable job in the DLT right now on this workforce issues, and I expect he'll continue to do it, and he certainly keeps me posted on it so that we're making good decisions to make good things happen. Okay. Thank you.